Hi there. Today we're talking about ADHD in girls. ADHD in girls is often underdiagnosed, and so many people feel like their girls have slipped through the cracks and have not had the resources available to them. In a recent study published in Reuters, they found that girls with ADHD have a high comorbidity, in fact, 5 times the normal amount of the neurotypical population of girls with ODD, which is oppositional defiant disorder. They're also 3 times more likely to be depressed and 4 times more likely to suffer from anxiety. This is really, really important to know because our girls can be suffering not only with this focus and attention challenge, but as they're moving on to their adolescent and teenage years, they might also be suffering with anxiety, depression, and ODD. But there is help available. Coming in to get a QEEG, which is a full brain map, we'll be able to assess not only if your child will have symptoms of such things like ADHD, but also give you an idea if they have also started to have changes in their brain that are associated with patterns as depression, anxiety, and ODD. If you have anybody who can benefit from this or your child is suffering, feel free to come in and get checked out. Thank you so much for tuning in today. Appreciate you taking a look. Bye-bye now. Hi there. Today we're talking about ADHD in girls. ADHD in girls is often underdiagnosed, and so many people feel like their girls have slipped through the cracks and have not had the resources available to them. In a recent study published in Reuters, they found that girls with ADHD have a high comorbidity, in fact, 5 times the normal amount of the neurotypical population of girls with ODD, which is oppositional defiant disorder. They're also 3 times more likely to be depressed and 4 times more likely to suffer from anxiety. This is really, really important to know because our girls can be suffering not only with this focus and attention challenge, but as they're moving on to their adolescent and teenage years, they might also be suffering with anxiety, depression, and ODD. But there is help available. Coming in to get a QEEG, which is a full brain map, we'll be able to assess not only if your child will have symptoms of such things like ADHD, but also give you an idea if they have also started to have changes in their brain that are associated with patterns as depression, anxiety, and ODD. If you have anybody who can benefit from this or your child is suffering, feel free to come in and get checked out. Thank you so much for tuning in today. Appreciate you taking a look. Bye-bye now. Hi there, Dr. Carrie Chapino here. Today we're going to speak about ADHD and sleep. I hear this all the time in my practice. My child has focus problems, they have attention issues, and they just don't sleep. They either have a lot of trouble falling asleep, staying asleep, or when I go into their bedroom, their sheets are all over the place. It looks like something exploded in the middle of the night in their room. It's just that they are all over the place. They're totally not sleeping soundly. Now, there are a lot of factors that can affect children sleeping, and there's certain things that we can do to help their environment to get a good night's sleep. Things like making sure they don't have any electronics or any screens before bedtime, because the LCD screens can really wake up the brain, and that's the last thing we want. Also, we can try to really wind them down with maybe some reading, making sure they're not having any sugary foods, and also, of course, completely eliminating any of these energy drinks or caffeinated drinks that are really bad for the kids. So that's something to address. But sometimes the cause of the sleep disturbance is actually dysregulated brainwave patterns. And that's one thing that we look at with BrainCore. With BrainCore, we do a QEEG where we evaluate different parts of their brain and see where they're having any kind of brainwave dysregulation. And some kids with ADHD, in fact 85% of them, have these sleepy brainwave patterns in the front of their brain. And typically they're put on stimulant medications when the parents are choosing that for their child. And the stimulant medications, guess what? They speed up the brain, so they might really help the focus and attention. But if you're speeding up the brain, what else is going to happen? They're not going to be able to shut it off when it's time to go to sleep. And when it's time to go to sleep, guess what? When we're sleeping, our brain does a lot of cleanup. Our brain converts short-term memories into long-term memories. So having restorative sleep is super important. So if you find that your child has ADHD and has sleep disturbances, BrainCore might be able to help you. Come in for a QEEG, have a consultation. We'll do a complete examination, full history and consultation, and we'll be able to tell you whether or not we should be able to help. Thanks for tuning in, and we'll see you next time. Bye now. Imagine if you could connect to who you were before the Big C diagnosis. Wouldn't it be amazing to tap into the way you used to feel? Your feminism, your vavoom, your life, the way it was. I've been there. I am you. Let's embark on this journey towards healing all parts of you, towards creating the life you deserve and were meant to live. Sign up now to get instant access to the beginning of your transformation. You will get better. You can get your happy back. Hey ladies, just wanted to let you know that the Healing Boobies meditations are now available for purchase. There are a variety of titles available, including some that are very specific with those of us who've been through the big C, things like fear of reoccurrence and anxiety before a checkup, and then some generalized one like being able to get a good night's sleep and decreasing our anxiety and forgiving others. So I hope you enjoy them. Just a little background about meditation. Meditation's been around for thousands of years, and meditation is our way to defrag our computer, ladies. So really what we do is we're able to shut down and bring our brain into a certain brainwave pattern that allows us to heal. So it's super important. The meditations can be purchased with or without background music. And in the meditation, in the beginning, I bring you into a comfortable position to begin your meditation. If for some reason how I am guiding you in the position that I am putting you in is not comfortable, then please, the most important thing is to make yourself comfortable. So just get into a comfortable position, because if your body's in pain, it's going to be difficult to get into the meditation. That being said, if there's a day that you can't get comfortable no matter what, still meditate. It can help. I'm really looking forward to this, and I'm hoping you ladies really, really love the meditations. Thanks so much. Talk to you soon. Bye now. Hello, it's September, and we are talking about ADHD and how to help our kids have a better school year. Very often I'll hear parents come in with challenges with their children with focus and attention, and one of the first things I recommend them to do is to do a QEEG, which is a full brain map, so I can see if I see evidence of their challenges with certain brainwave dysregulations. So when I look at the QEEG, I'm going to show it to you right here. This is the thing that we see very often, in fact 85% of the time when we see kids that have ADHD diagnoses. And this is red and yellow in the front of their brain in theta. And theta is that brainwave pattern that is associated with falling asleep. Okay, we should not have high theta waves as we're going about our normal day. We should have high theta waves as we're laying in bed trying to get to sleep. And so you can imagine this is why kids might have challenges with focus and attention, because they have too many of these sleepy brainwave patterns in the front of the brain. How neurofeedback helps is we put two sensors on their scalp and we reward their brain as they're watching a movie by making the movie bright, and you can hear it very well when they're producing higher brainwave patterns in the front of their brain, not those theta brainwaves. In the front of the brain, it's also where we have our attention areas. So areas of dysregulation in the front of the brain are a telltale problem that there's going to be a challenge with some kind of learning. So if your child is having challenge with focus and attention and you want to know if neurofeedback can help, the first thing I would recommend is get a QEEG so we can evaluate their brainwave pattern. And at that point, we'd be able to let you know if your child is a candidate. Thanks for listening. See you next time. Hi everyone. Today we're talking about adult ADHD. You know, ADHD has been around for years and years, and most of the adults that I treat now really feel like this is a struggle that they've had their entire life, and it was sort of swept under the rug, and it was really disciplined instead of addressed clinically. So instead, children were told to sit down, they should be seen, not heard. Stop with all those ants in your pants. You're not a jumping bean. Sit down and behave. And it wasn't really addressed in the sense that they had a real specific neurological challenge going on. And we've talked about neurofeedback before for people who have ADHD. And the difference between children and adults is that kids can respond really, really quickly, and they can respond quickly because they haven't had these pathways for very long. But when I treat adults, very often they started with ADHD, and then as it progressed, they can also progress into certain other kinds of challenges, like having not the best attention span, but also have developed an anxiety disorder later in life, or maybe experience some depression. And this is because when one area of the brain becomes dysregulated and it stays dysregulated for years and years, it can start to create fallout in other parts of the brain. So with BrainCore, what we do is we do a QEEG, which is a full brain map, and that brain map is able to tell me where the dysregulation in the brain is and what kind of dysregulation is present. So we talked before about how as the brain responds to its environment, it speeds up or it slows down. And so sometimes the brain is not able to respond as well as it should. Neurofeedback helps to make new connections in the brain, allowing the brain to function in a more normal way. So yes, neurofeedback can help adults with ants in their pants, or shall I say ADHD. It can also help with challenges like anxiety or depression that kind of came along because of the chronic dysregulation that's creating the ADHD. All right, until next time, hope you found this helpful. Bye now. Hi everybody. Today we're going to talk about ADHD, but I'm going to talk about a little bit of a different presentation than we see typically. Very often I'll have a case where a parent brings their child to me and they say, you know what, my child's been diagnosed since they were little with ADHD, and we've tried medications and they've seemed to have every side effect in the book, and we just don't understand what's going on and we need help. And so very often when I run a QEEG on those patients, which again is that map that allows me to look at their different brain waves, instead of seeing the under-aroused brain that is typical in ADHD, I see something called an over-aroused brain or an excited brain. And so an over-aroused brain not only can present in the sense of ADHD in the atypical way, but also things like the child might have anxiety, the child might have tics, the child might have some OCD or compulsive behaviors, sometimes really ruminating over things. If something happens, it's really hard for them to let go. And to explain how that over-aroused brain works, it's almost like when you have a computer and you're on your computer and you have all the tabs open and you have all the circles going on all the tabs and you're trying to complete something, but you just can't because there's so much going on in the background. So that's what an over-aroused brain is doing. And that's why it looks like ADHD, right? Because their brain has all these other programs going on in the background and they can't attenuate or focus at the task at hand. So to help kids that have an over-aroused brain and have the challenges of focus and attention issues, typically what we do is we train their brain to go into the lower gears. And when we train their brain to go into the lower gears, their attention can improve because they don't have all this background noise going on. So neurofeedback can be really helpful for that population of children and adults who have ADHD and haven't responded to the medications, or especially if the medications had made them worse. Because typically stimulants are going to speed up the brain. And for 85% of kids who are diagnosed with ADHD and have an under-aroused brain, that's why you can see results with them. But for those 15% of kids who are taking those medications based on their ADHD symptoms, they have that over-aroused brain, they're not going to do as well. And that's why you see all these side effects. So if this sounds like anybody in your family or friends, please pass along this information to others. Thanks again. See you next time. Hi everybody. Today we're talking about teenage anxiety. There are a lot of demands on teenagers nowadays. The academics, the athletics, the social pressures, and some kids are able to manage better than others, just like certain adults can manage better than others. And today I wanted to talk specifically about neurofeedback and how neurofeedback can help with anxiety. You know, I've talked to you before about how the brain is supposed to shift gears, right? Speed up to learn something new, slow down when we want it to go to sleep, and then stay in kind of an idle gear when we're doing things that are routine. When kids get stuck in this anxiety, what happens is that they get stuck in these higher gears. It's called beta waves, and this is why they may not sleep as well as they should, or why they just have that constant angst. And this is really, really important to address. I hear more and more cases of teenagers finding other ways to deal with their anxiety, whether it be drugs, alcohol, cutting. I mean, I've heard so many challenges. And this is a non-invasive way to really help your kids get the help that they need. This is a tool that we can use. Neurofeedback helps to train their brain to have a different pattern. So instead of being revved up, we're rewarding the brain every time it slows down. And what greater gift can you give your kids but the ability to self-regulate themselves, right? You know, if this prolongs, then they find other ways to make themselves feel better, and it's not always the best choices. And we know that the prefrontal cortex, which is the front of the brain, really develops while we're in our teenagehood. And so without that development, they're not able to inhibit their brain the way it should. So in other words, they might make impulsive decisions. And this impulsivity can really create lots of challenges for the whole family dynamic. So my suggestion is, if you have a child that's struggling with anxiety, don't wait for these other things to pop up. Address it now, address it at the source, and get a QEEG so that we can see if that's what's going on with them. Thanks for listening. Talk soon. Bye. Hello, today we're talking about headaches and the neurological dysregulation pattern that I see associated with it. A brain, when it's functioning normally, is able to shift gears all day long, right? So we're able to speed up when it's time to learn something, slow down when it's time to go to sleep, and maintain this sort of neutral gear when we're doing things that are routine for us. Very often we see in patients who suffer specifically with migraine headaches is that we see that they have this sped up version of their brain. So their brain is just in high gear all the time. And so what happens is, as our environment changes, whether it be a little bit less sleep, a hormonal fluctuation, and or certain foods that may trigger the migraine, what will happen is that we'll have this neurological dysregulation that really plays a big part in manifesting the headache. So with brain core therapy, what we do is we train the brain to be in a lower gear. And when we can train the brain and reward the brain to be in the lower gear, people have less headaches. There's a lot of research regarding this kind of challenge, and we've seen great results here. So if you have someone in your family or friends that needs to hear this message, please pass it along, and we look forward to helping you. Bye now.
People take medication every day for anxiety, depression, even insomnia. But a new technique could make it all go away by simply using your brain power. CBS 2's Andrea Grimes shows us how you can train your brain.
When it's light or bright, that's when she's producing the desired brain wavelength.
That's right. This patient is manipulating the brightness of the screen with the power of her mind. It's a treatment called brain core therapy.
Your brain is constantly being molded with a feedback mechanism, a positive reinforcement to show you that this is the proper brainwave pattern.
Positive reinforcement for this therapy entails making a video screen appear lighter, or here, keeping a roller coaster moving smoothly. It works, according to Dr. Carrie Chapino, by patients concentrating on these activities. She says research shows that over time, the brain will establish new connections that can help break the cycle of depression, insomnia, and certain pain.
I'm not about to get a facelift, but I can give my brain a lift.
Marilyn Sokol says she was having issues with mood, focus, and trouble sleeping, so she tried brain core therapy.
I'm really sleeping and not getting up for any reason.
She saw other benefits too.
I was always a slow reader. I do believe that there has been an improvement.